Angela, I'm going to mute you. There's so much background noise from your hand.
I'm already muted.
Okay, yeah. That's all right. Okay, so welcome everyone. Welcome to ACP Live Monday. We're going to start soon, but please kindly share the video. Kindly share it to your friends. I'm also going to try and see if I can just share and pin it on our various groups before we go live. Before we start answering the questions. Okay, so invite friends, invite your family, everyone. And I can see those of you on Instagram and those on the Facebook groups as well. So if you are in our ATP Still a Mom or ATP Family Facebook group, then I'm sharing the video to your group. So which means you have to click on the video to drop your questions for us to be able to answer it. But if you are on our ACP Facebook group, you can actually drop your question straight into the on that video you're watching on, and we will see your questions straight away. So the same thing for those on the page, the same thing for those on YouTube. So we can always see your questions. So I guess we all side just one more minute. Let me just make sure they're all pinned. Okay, I guess we are set. Angela, do you want to unmute yourself now? Angela, do you want to unmute yourself? Okay, I'm not sure whether Angela's network is having issues. She seems to be frozen. Okay, so we're going to start now. So if you have questions, please drop your questions on the Facebook group or the page or whatever sharded question you have. Try and drop them now, and we'll try and see how much of them we can do in the next 1 hour. So welcome everybody. I have with me Angela, but I don't know what's happening with Angela's network. She seems to be frozen. Angela, can you hear me? You can unmute yourself. Angela, you need to unmute yourself first. Okay, I guess there's a problem with Angela's network. Okay. Okay. Oh, that's a question. I was always going to pass it as a great thing. Okay, so for those on Instagram, please drop your questions. Drop your questions. I can see you. Sorry, I'm always good. Daniel, Cakes, Iberi, Joanna, Kim Esther. Mimi Spies, all of you, I can see you, you're welcome. Okay, so I'm just going to start. Hopefully Angela will join me later. So the first question I got this evening is what the treatment for oral thrush. So oral thrush is a fungal infection, and so the treatment is an antifungal medication. So, but instead of you just going to do self-medication, you need to see a doctor, because the first question we want to know is why is your child having the oral thrush. We need to be sure there are no underlying immunosuppression or anything that will make a child to have the oral thrush. So I hope you can hear me. Oh, let me just make sure my voice is okay. Yeah. So you need to make sure there is no reason why your child is having the oral thrush first. So it's not just to give medication, but it's also to make sure that um, the underlying cause itself is treated. Just 1 minute for Instagram people. Okay. Yes, I'm a bit brighter. You can see me brighter now. Okay, so that's the first sense. So just like we're into medication, we say no self-medication. See your doctor and they can prescribe appropriate treatment for you. Okay, and then the next person, well done, friend. I'm proud of you. You're doing a good job. Thank you. Young Queen is asking for cold on infants and babies. Can one give medication to relieve cough and catarrh, even though you've said this drug doesn't cure it since it's a viral infection? So we don't recommend for you to give any cough. If you meant cough syrup, because you're not very specific in your when you say can we give medication, which medication specifically are you talking about? So we don't recommend for you to give any cough, so-called cough syrup or cold preparation for children. We don't recommend them. If your child has blocked nose, you can use saline drops to soften the mucus to make it flow out. Otherwise, there's really no need to use any form of medication for children. Like we told you, the most important thing is to keep your children warm, keep exclusively breastfeeding for children below the age of 6, keep them away from people who have cough and cold where they can get the infection. But if they already have it, it's going to run its course and it's going to stop. So I hope that's helpful. Good evening, everybody. Next, so for those of you who are on the Facebook group, if you want us to see your name, you need to give StreamYard the permission for us to see your name. If you go to the top of that video, you will see where it says give StreamYard permission to show your name, and then you can click on it and your name will show whenever you type. But if not, I'm only going to be seeing your name as a Facebook user. Okay, so somebody's asking, can I take routine drugs such as folic acid, B complex, vitamin C, cod liver oil? I don't know who is taking the routine drug. Is it yourself or your baby? Because there's nothing routine about these drugs that you have listed. There's no routine drug. So for you or for babies, if you are talking about maybe drugs for a pregnant woman, that the doctors recommend, yes, but there's no routine drug for babies. There's no routine drug for breastfeeding mothers. So you really need to be very, very specific about what you meant by routine drugs. So it's okay if you want to take multivitamins. It's okay if you want to take your folic acid or iron supplement. But I'm very, very very cautious when I'm answering questions. So I don't want people to go away with the fact that there are some drugs that are routine. Like, so when you use the word routine, it means that anybody who is pregnant or anybody who is breastfeeding should be taking those drugs. There's nothing like that. So there's nothing like you must be taking this drug because you are breastfeeding, or you must be taking this drug because your baby is on breastfeeding. No, there's nothing like that routine drug for babies or for breastfeeding mothers. So the only people that we tend to recommend routine drugs for are pregnant women when they're pregnant, and the doctors will tell them what drugs they want them to take. Usually they are mostly multivitamins and iron supplements anyway. So young queen say, also saline drop is guide to get in my neighborhood. Can I go old school by sucking on the nose with your mouth? No sucking on the baby's, no sucking the baby's nose with your mouth. Never. It's not. Saline drop is not hard to get. It's available. Saline drop is the same thing as a normal saline that they put in your as drip for you. It's the same saline. There's nothing different. It's just that it's packaged as a smaller bit. So if you can't get the saline drop that's been packaged into a smaller be so that you can use as drops, then you can just buy the normal saline. The normal saline is about 500 mils. Of course, you don't need so much. That is just the essence why we don't say you should buy that. But you can rather buy that and use it, but you have to make sure you cover it properly so that it doesn't get contaminated. That's all. It's just the same normal saline. There's nothing special about it. But if you go to any of those big pharmacy stores, I'm sure you're going to get saline drops. It's available. So no sucking on the baby's nose with your mouth. I'm not going to go into all those details, but it's not recommended. Um, good evening, doc. I have a girl that doesn't breathe. That doesn't breathe. What do you mean? That doesn't breathe everyone. I'm not sure what you meant, but anybody who is not breathing is dead. So I guess that's not what you really wanted to say. Most time he breathes with his mouth. I guess we want to say the baby is not breathing with his nose and is breathing with the mouth. So if a child is not breathing with the his mouth breathing, which is the only part of your question that is clear to me, then you need to see a doctor because they need to be sure there's nothing that is blocking uh, the nose of the child, like any obstruction in the airway, things like adenoids or those are likely things that can cause airway obstruction. And when there's an obstruction, then children can start opening their mouths to breathe. So you really need to see your doctors to know why your child is mouth breathing, and then they can now tell you what is the um, appropriate intervention. Okay, I think Angela is back now. Is your internet back? Is okay now? Can you?
I had to move outside. Apologies, everyone. I'm just in the car. I think it's better here.
Yeah, I think it's better because you were frozen and we
Yes.
couldn't hear you, so it was quite challenging. Okay, so welcome back. So I
Thank you very
think
much,
so you
ma'am.
can let me. Where did I stop now? Yeah, I think I stopped with the person with mouth breathing. Yeah. Okay. Facebook share is just saying hello to us. I'm praying for us. Thank you. Okay, so let's go to
Thank
the next
you.
question. Yeah.
All right. So from Ejezie Anita Chidiogo. Good evening, Doc. Please, my question is, what can be given to a baby of 6 weeks to suit immunization pains? One of her labs is swollen, birth weight 3.1 kg, current weight 4.7. Is her weight normal? Thanks. She's on formula cause of complications during delivery.
Okay, so thank you so much. Straightforward to the question. So if your baby has immunization at 6 weeks, 10 weeks, they are prone to having fever. So what you can give is paracetamol. This kind of information should have been given to you at the health center at the immunization spot. They should have told you what to do. Anyway, give paracetamol, and you need to know the right dose to give because whether you're giving paracetamol syrup or paracetamol drops, it's not just some people just say it's zero point 0.3 or 2.5 minutes. No, it's not like that. It's based on the weight of your baby. So for your baby who is about 4.7 kilos, that's about if you multiply by 15. So I'm not remembering my maths very well now. I need to use a calculator for that. But if I approximate your baby's weight to be 5 kilos and we get 15 kilos, that's about 75 milligram per that we expect your baby to take per dose. Most dose of paracetamol is 120 milligram in 5 meals. So which means that your baby is going to be taking 60 milligram is 2.5 mils. So your baby will be taking something between 3 to 3.5 mils, something like that. So that is what you should give. And you can give it every 6 hours. So you can give like 3 meals every 6 hours of paracetamol for the effect for the next 2 to 3 days. That is all you need to give your baby. Then you can apply ice pack. So you just get ice block cubes, from your fridge, wrap it in maybe 4 or 5 of them, wrap it in a white any handkerchief anyway, just wrap it, and then you can put it on the baby's lap intermittently. It's not to rub, it's not to massage, it's just to put a little bit of coolness in that area, because what is happening with that immunization is that is a deep intramuscular injection, so there's some bleeding. It is that bleeding into the muscle that causes that swelling. So what we are trying to do is to stop the bleeding and to allow it to cool, and then it's going to clot, and then it may form like a hard lump when you finish clotting, but eventually it will melt away. But please don't introduce germs into it, because that's what people do when you massage, when you do all those things. You're actually causing the bleeding to be more, because when you massage, you're actually causing those blood to vessels to break the more and bring out more blood. And when you use your hand to do all those massages, you are introducing germs into it, and then they can become infected, and then it becomes what we call an abscess, and then that would now require antibiotics or even surgery for us to remove the pus. So that is all you need to do. Intermittent application of ice pack, maybe it's not like you're supposed to leave it on for continuously. Just leave it for maybe 5-10 seconds to take it away. In another 2-3 minutes, you put it again. Just keep doing that. You just for the first 2 days, and you will see that the swelling is less painful. And of course, you are very gentle with the handling of the leg. Some of you are not very careful. Even after a child has gone through that immunization, you're just still carrying them, flinging them up and down. You need to really be gentle the way you handle them, the way you handle their legs, so that they don't feel as much pain, because that will make them more irritable. So that is all you need to do. So the weight of your baby is fine, but there's no complication that say you cannot breastfeed your baby. There's no complication during surgery that say you cannot breastfeed your baby. What the worst that can happen is that you have a cesarean section. They don't operate on your breast, so your breast will flow. Some people you may not be awake initially, which means that you may not start breastfeeding within the first 1 or 2 hours. So, but immediately you are awake and your baby is brought to you, put your baby to the breast, even if they started the formula before, but you are awake now, your baby is 6 weeks, and obviously you are okay. I mean, for you to be writing to me, you are okay, then you should breastfeed your baby, because that is the best way to feed your baby. Exclusive breastfeeding is not just about food, it's about protecting your baby from diseases, from infections, from allergic conditions, and also long-term benefits to your child, even as into adulthood. So when we talk about breastfeeding, it is not just the short term. Let's just give baby something to feed their tummy. We're talking about other benefits that is beyond just filling their baby's tummy with food. And that is what we're always trying to make mothers to say. Most of you are always thinking just about the fact that the baby is eating and baby is gaining weight, and that is all you think, that is all to it. That is not all there is to it. There is more than food. And there's no other thing that's going to give your baby those protection, because when your baby is born, your baby does not have as much protection, like because not much of immunity, not much of all that. So you are the one that has been exposed to all these germs. You have all the antibodies. The only way you transfer it to your baby in that first few months of life, while the baby is still struggling to find their own level of immunity, is through your breast milk. Always think about it, that breastfeeding is more than food. It's not just about formula. Formula is just food. There's nothing else they're going to give your baby. But all the other protection, antibodies, and all those things, they are only from breast milk, and it's customized for your baby, because you are the one that's you've been exposed. So what you are producing is different from what mother B or mother C is producing. So I will encourage you to still breastfeed your baby, even though you started formula feeding. It's just 6 weeks. You can still start breastfeeding and continue with breastfeeding. Okay, so let's move on. Angela, are you there?
Yeah, yes, I am. Anita, I hope you got your answer there. This is from another person. Good evening, Ma. Please, what healthy meals can I give my 2-year-old?
There's nothing like unhealthy meals. Or maybe I should not say there's nothing like unhealthy meals. But what I really mean is the fact that there's no food that you eat that your baby cannot eat. So you should give your baby all food that you eat. All you need to do is to make sure that you put them in the right proportion and in the right quantity. Okay. So that is what we call it complementary feeding and all that. So if you go to our Facebook group or even on our website, we talk about the different food classes. We've had even a whole session with our nutritionists, and they've come to teach us of what is it. So you need to know that there are different kind of foods. So you have the carbohydrates, you have the protein, you have the fats and oil, you have the fruits and the vegetables, which give you vitamins and minerals. Of course, you have water, you have dairy. The most important thing is that anytime your baby is eating, your baby is not just eating one particular class of food. Your baby is eating as up to like 4 or more of all those classes of food. So if you just Google or you go to our website, we have a concept what we call the food plate. The food plate is divided into like four. So there must be a portion for the carbohydrate, there must be a portion for protein, there must be a portion for your, the fats are not usually very small. Of course, you can use it with your cooking. There must be a portion for vegetables and fruits, and of course, you can have a drink, which can either be water or your milk or dairy. So if you always have that concept in your mind when you're making your food, so you can now decide by yourself how you want to combine it together. So, and it should be variety. So it should not be the same combination every time. So you should make sure that it is a variety of those combinations. So I always say parents, I don't give parent food timetable, and I don't tell you what to give your baby. I just tell you the principle behind you're feeding your baby, and that is what you are the one that should now work out whether it's apple you want to use as your carbohydrate, or whether it's semo, or whether it's bar or whatever, or then whether it is a wedu that is your vegetable, or whether it's spinach or whatever is there, or whether it's banana you want to use for fruits, whether it's you make variety, be creative, and there are lots of websites and online that have all those information on how to combine all this. And so you just do your research, work out what you like, what you eat, because your 2-year-old should be eating what you are eating as a family. So that's all you need to be doing for your 2-year-old. Just make sure your baby is taking variety, and there's fruits, there's veggies, there's protein, dairy, milk, all those things are all there, and then your baby will be healthy. And of course, quantity is also important as well. So I'll just leave that. So it's about principles. But if you want more information, you can watch our complementary feeding videos. They are available on our website. I mean, not our website, our Facebook groups, or our YouTube channel as well. Okay. I think we should go to Instagram, and then I'll come back because we're almost halfway gone, and we have not even been to Instagram. Oh my goodness!
All right.
Instagram have. Okay, so for those of you on Instagram, you may not see Angela, but trust me, she's there, and I'm sure you can hear her voice, but you can see me.
Hi, Instagram fam.
Yeah, sometimes I try to turn this thing, but I don't have time to prepare all those scenarios today. I have to turn my camera sideways, and I guess I'm going to mess up so many things by trying to do that now. Okay, so somebody is asking a question. Okay, yeah. Show me for King is, can a baby who is on EBF be dehydrated? How do you know when a baby is dehydrated? If a baby is on EBF and is breastfeeding exclusively on demand, your baby cannot be dehydrated. So the only way an EBF baby will be dehydrated is because you are not giving enough milk. If you are not breastfeeding well enough, you are not breastfeeding on demand, then your baby, because your baby will, if you are lactating well, your baby is sucking well, the baby will take all that they need, and so the baby cannot be dehydrated as long as baby is getting enough of the breast milk. So that is the most important thing. Joanna is saying, I want to appreciate the work you and your team are doing. Thank you. I always use the search box on the page to check all my questions as a first-time mother that's been greens. God bless. Oh, thank you. So these are the kind of, these are the people that I love, people that already know how to find their answers without dropping. They give us less work to do, but we appreciate the fact that you can do that. But we also appreciate those who ask. If you ask, you will find. So it's okay. But like I always said, you can always find your answers by yourself. Just put in your keyword search into our search box, or go by our topic. We have over 150 topics, topics on every issue. So for example, if you are looking for information on breastfeeding, you just need to type breastfeeding into our search box on our Facebook group. You will see so many questions on breastfeeding. You also have the guide section on breastfeeding. So by the time you go through all those, I'm sure somebody has asked the question you are asking, because I doubt there's anything new under heaven that we have not answered. But we also have our website for those of you that just want to read the information without reading through all our individual scenarios and all that. You can just go to our website, www.paediatricians.com, and you can also just search as well, breastfeeding, fungal infection, skin, anything you want to know about, and you will get all your answer. We used to have our mobile app as well, but we are working on our mobile app. We want to make it more user friendly and more AI compliant. So hopefully we'll get it back again. That's another way which you can get answers to your questions. All right. Hair laundry. Good evening. How do I clean my baby of 11 months is? So for any baby that has teeth, even if it's only one tooth, you use your toothbrush and the toothpaste. And they tend to say it must be fluoride containing toothpaste. But the fluoride they need as babies is lower than the what we need as adults. So there are toothpaste specially made for that age group so that the quantity of fluoride is a little bit less. So if you go to the shops, you just look for toothpaste for babies, but make sure it's the one that contain fluoride. And so that is all you need to do. And you can brush their teeth day and night. So initially you will need to help them. Sometimes you may need to use those finger toothbrush yourself. And as they get older, you might now use bigger size toothbrush. They are all available in the shops. And more importantly, make sure the size of your toothpaste is small. So for babies below 3 years, it is a grain of rice. So the grain of rice, remember, you just think of your rice before you cook it. That grain of rice, that is the quantity of toothpaste your baby needs because they can't spit out your toothpaste and they may swallow it. So we don't want them to be exposed to too much of those fluoride as well, or, so that they don't have what we call fluorosis. And when they are about 3 years and above, then you can go to what we call peanut size or granules, like your granule, that size is what they need and that's all you need to do. And it should be twice a day after breakfast and after dinner at night. Okay, so Iberi Jamas, I want to know if I need to give my baby paracetamol after the 1 year immunization. So immunization, paracetamol after immunization is not like you must always do it. So if the child doesn't have fever, there's no need to give paracetamol. So the one that most children invariably have fever is a 6 weeks, 10 weeks, and 14 weeks because that is the DPT vaccine with some mix of other one. Usually it's pentavalent. In some places they give hexavalent, like 6 vaccines in one. So most children tend to have fever after that. But if you give, like by the time they're going to that 9 months and all that, and they don't have fever, you can actually wait and see whether they have fever or not before you give paracetamol. Don't just load them with paracetamol. So if there's no fever, don't give paracetamol. But if they're having fever, yes, please give paracetamol. Somebody is saying Damila is saying my baby of 17 months has catarrh. I've been battling with it for a month. Catarrh for a month, that's too long. That's a long one. I have been to the hospital, good. I've used the drug administer, have done steaming, it has not gone. Now you need to go back to the hospital. So general answer, if you have been to the hospital and your child is not better, please go back to the hospital. It does not mean the doctor does not know what they are doing. It does not mean they are clueless or anything. There are reasons why children don't get better sometimes on our treatment. Number one, we may be wrong with the diagnosis, and there's nothing wrong with that because we are not oracles. We don't always claim to say we know everything. Sometimes doctors think of there are maybe 2 or 3 or 4 things that may cause this thing, but the doctor is saying this is the most likely one. So they go with the most likely one, but we may be wrong. And then if the treatment is not going, then that may be the wrong one. Or it may be that the treatment was also wrong, or it may be something else. So, but if you don't go back, there will be no room for you to be able to figure out. But you go to another doctor, that doctor will start all over again, also starting what Dr. Hay has done, and then you keep wasting time. Then many people now say I've gone to 3 or 4, 5 different doctors, and it's because you should have gone back to the very first doctor. Unless you have any reason to doubt that doctor's competence. That's why I always say you make sure you go to hospital or doctors that you trust them, because there are actually fake doctors as well. Or go to government hospital. Government hospital, you may not like the fact that they make you wait and stress your life out, but at least you can be sure that you are going to see genuine doctors in the government hospitals most times, most of the time. So you can try that and go back to them for follow-up, and they will now want to look for other things that are not so common but can also give the same scenario. So if a child has been having catarrh for 1 month, it's that if it is the catarrh has never gone, it's different from the catarrh has gone and come back. Because parents, sometimes you tend to exaggerate things by saying that, oh, I've been treating this condition for 1 month, but it's not necessary that the child has had the catarrh every single day for 1 month, but maybe he had it for 3 days, it's when then it came back again. There is a different scenario entirely. from the child is having catarrh every single day for 30 days, definitely there's something wrong. So if usually for things that is going, we start to think of, is this something allergic? Is this something, is there something in the nose? Maybe the child has put something in the nose, a foreign body in the nose. There's no drug you're going to give, the catarrh will not go until we remove the foreign body. So these are some of the things we think. And usually by the time you go back to the initial doctor, if the doctor thinks I've done what I should do at my level and it's not going, then I may want to send you to a doctor who is the expert in that area. For example, every single part of a human body has an expert. So for the nose, for example, because your baby is having catarrh, that's why we have the ear, nose, and throat doctor. So there are doctors that all they do is the ear, nose, and throat. So we may have to send your baby to those kind of doctors. Like we think this is common catarrh, we've treated, it's not going, then we think maybe there's something more. So they may want to look into the nose of your baby. They may want to see whether there's something there that the child has stuck into their nose and we don't know. So this are the kind of, that is why you need to go back. Don't just keep treating again or trying all sorts of recommendation by neighbors and friends. Go back to the hospital. It's very, very important to know what it is. Okay, it's good that your baby is still breastfeeding. Ajoka is saying my 3 months old baby pull at every meal. Is that normal? Yes, it can be normal as long as the poo is not watery. As long as it's a normal poo, that is fine. There's nothing to worry about. Somebody say my daughter of 5 years has been having frequent cough on and off for a month since she choked 1 year. So your baby had a what we will call aspiration, I guess that's what you're saying. If your baby has aspiration and then now start having cough on and off, you need to go back to the hospital. Did they do a chest x-ray? Did they get rid of whatever the child choked on? What is going on? As the child now developing pneumonia, whatever it is. So it is not something you really need to go back to the hospital, and the hospital need to take it further because we need to know number one, why did the child even choke in the first instance? Was a 5-year-old choking very unusual unless there's something else also ongoing or it was an accident, which can happen. But then the child is not having cough on and off, then we need to know whether that aspiration is related to why the child is having the cough on and off now, or it may even be something different, it may not even be related to the choking at all, but we need to know why. Okay, I guess, okay. Let me see this question in question box. So Ade baby say my son will be 3 years in 3 years in a month. Okay, and he hasn't started talking. Please, what can be done? So a child who is not talking at 3, um, as what we call speech delay, you need to see a speech therapist and a developmental pediatrician because we need to know why the child is not talking. Now, some people just don't fall for this advice, which is what most Nigerians will tell you. Oh, it's just a boy. Oh, it's just been slow. Oh, it's just been late. And they will tell you, don't worry. Even me, I didn't talk until I was 4 years. Even me, I didn't talk until I was 5 years. That is a very dangerous thing to do. If a child is not talking, you need to see the experts, you need to see the speech therapist, you need to see a pediatrician. We need to know, yes, some children may be late talkers, they may be late bloomers, but some children actually have developmental disabilities. Some children have autism spectrum disorder, some children have other developmental disorder of language and all that. So if we don't do an assessment, we will never know whether this child is just being slow or whether this child has something else underlying. And whether slow or there's an underlying thing, all the children will need support. And that is where the speech therapy will come in. So the child will benefit from speech therapy. A 3-year-old should be talking. A 3-year-old should be talking sentences. A 2-year-old should be combining words. So I always tell parents the rule of the thumb: 1-year-old should be saying single words, 2-year-old should be saying 2 words joined together, 3-year-old should be saying at least 3 words joined together. So if your child is not talking, there is a problem. And we need, but one of the things we say in developmental pediatrics, because that is my field, is the fact that early therapy works, early intervention works. So it's best to go to the for therapy and your child gets better and we say, okay, your child is fine now, rather than for you to delay. And then some of you start coming to us at age of 5 years, at age of 6 years, when the children are in school and they are now struggling. Whereas if you have come at the age of 2 years, 3 years, and you've gotten therapy, they would have done much, much better. So that is why it is so important for you to um go to the hospital. And then can we give them vitamin C if nothing's wrong with them? You don't need to give vitamin C as a routine drug. Give your children fruits, give them vegetables, they will get the vitamin C from that. So as much as possible, don't be giving your children chemicals, drugs, all those things is really unnecessary. Give them natural fruit. So the vitamin C is in your oranges, they are in your lemon, all those your citrus fruits, your tangerine. Give it to them. They will get their vitamin C from that. Let them eat vegetables. They will get their vitamin A from all those green leafy vegetables, from the carrots and all that. So we prefer natural sources of these things rather than all these chemicals here and there that we're popping our kids with, because those chemicals are never alone. There are other things they add to them. They call it additives. They are not so much, but they are not necessary for your children's body. Okay, then final question from Instagram before we go back to Facebook. Ajaka is saying, thanks for the response. She weighs 4.2 kilos last week, and I gave birth to her at 3 kilos. I'm not even sure I remember what your question was. Okay, your baby that pulls every feed. Okay, that's fine. That's okay. No need to worry. Bisa is saying my 4-month-old baby keeps wheezing. Wheezing? The doctor here said they don't give drugs from bronchitis. Please, what can I do? Usually for a 4-month-old, it's not bronchitis. We call it bronchiolitis. And if your baby has bronchiolitis, it is not a drug per se that the child will need. I think the most important thing is to keep breastfeeding your baby and keep your baby warm. So most of those things, children outgrow them with time. But if your baby is really having difficulty with breathing and all that, then you need to go to the hospital because they may need to support the child's breathing. There are no specific drugs for treatment, but they are supportive treatment. So I hope that's helpful. Okay, so let's quickly go back to Facebook and hopefully we can. Okay, Angela, can you unmute yourself?
Yes, I'm here. Welcome back to Facebook. Just checking where we stopped. Okay.
Okay, we've done this one.
We've done this. We've done
Oh, sorry,
this.
sorry. I think I went. Is it this one? Yeah, I think this is where we
Yes.
went.
Yeah.
Yeah.
So from Sheyi Raji, good evening, doctor. Please, what are the causes of ringworms in children of age 6 and what's the remedy, ma? Thank you.
Okay, thank you so much. So ringworms are fungal due to fungal infection, and the remedy is antifungal medications. So that is that. So if your child has a ringworm, you need to go see a doctor. Don't do self-medication. See a doctor, let them treat the child, and that's it. Because if not, because the treatment is usually longer than what most of you think it is. For ringworm, depending on which part of the body it is, you have not even said that right now. So the treatment, sometimes we treat it for 6 weeks, sometimes we treat it for longer, depending on the medication we're using. So, and then the dose is depending on the weight of your baby. So when people just say, yeah, it's ringworm, just go and buy this, they don't know how long you should use it. They don't know what is the dose for your baby. They don't know what side effects. There are medication we don't use in certain children because they are allergic to it. These are things people don't know. But they will just say you go and use drugs. You think the doctor that wrote the drugs, they just write the drug. No, there are a lot of things doctors are thinking about when they are giving medication that you may not think we know we're thinking about. We're thinking about all those things. So that is why we always say, please do not self-medicate. Please see a doctor. If it's finance, please go to a government hospital for them to write these things. For children, most of the time they don't charge you for consultation. At least make sure you go to a proper hospital, not the health centers, please. Health center are not supposed to be writing prescription for you and all that. So go to a hospital from the secondary level to the tertiary level style. General hospitals, the mother and child hospitals, those are the hospitals with appropriate kind of doctors. Health center are mostly for just promotion, immunization, encourage exclusive breastfeeding, family planning. They are not for treating very sick children. Please because I see a lot of people going there and then they got messed up as well. Because in Nigeria, some of people don't know how to stay within the boundary of what they're supposed to do. It's really, really not the best. But I just have to say that so that people don't go to the wrong place and they say, oh, but you say I should go and I've gone and this is what happened. And then things are more messed up than what you started with. So that's why I always like to qualify my responses at times. Okay.
All right, moving on. Good evening, Ma. Please, when should I stop cleaning my baby's navel with mentholated spirits? She's 10 weeks today.
Okay, so immediately the umbilical cord has dropped and the navel area has healed. Like you can't see any wound again. It is just like a normal skin. Then there's no need to clean with methylated spirits anymore. So you're not, I mean, for a 10 weeks old baby, I'm sure that cord has healed forever. I mean, please stop. So usually by the time you don't see any raw area, wound, bleeding, anything, it's just like a normal skin, like the normal navel, then there's no need to cleaning anymore with the spirits. And it's methylated spirits because we don't want you to use mentholatum. I know maybe it's a typographical error, but for us, it's very important that I tell because some people are reading it and they may get confused. Please do not use mentholatum because a different product entirely from a methylated spirit. So methylated spirit is that spirit, alcohol, ethanol. That's the one we want you to use. The one that people sell as like rub, methylatum, please don't use it on the cord for your children because some people do that and it is wrong. Very wrong practice to do. Okay.
Right, this person is asking what causes eczema?
I guess it's eczema, not because I was
I
almost
think so,
confused.
yeah.
Okay, so eczema is a loose word that people use for some skin rashes. Basically, we use it in medical jargons as dry skin. When your skin is dry and it's rough and dry, we call it eczema kind of skin. But there are different type. There are different types. So the commonest one, actually for children, is what we call atopic eczema or atopic dermatitis. Is just basically due to an allergic kind of a reaction on the skin. So and I actually don't like also when parents say, oh, my child has eczema and all that, because most of the time people just use those words without really knowing the meaning of the words or really meaning it. So because people just think every rash is eczema or every rash is measles or every rash is this. So I always say just go to the doctor, let the doctor be the one to decide what is the type of rash that your baby has and the cause of the rash, because some people use those words uh, and it can be confusing to a medical person because the person may think this is what you meant, whereas that is actually not what is actually happening. So I usually don't like when people throw jargons around. I prefer we see what you are referring to and then okay, yeah, we can now say yes, that is what it is. So avoid making your own diagnosis. Let the doctor see your child and let them tell you, "Oh, this is the kind of rash your baby has and this is the treatment," and so on. I hope that is helpful.
Okay, so moving on. My son of 5 years, when he sleeps, he breathes noisily, not snoring. Also, his sweat is yellowish in his clothes and smelly.
Okay, so what is the question? Okay, because so when you put up things, always ask a question because you have just given me information. You have not asked me any questions, so I'm not sure what is the question. What do you want me to talk about? So number one, for a 5-year old, any noisy breathing or whether snoring, whether noisy, we worry about it. Breathing should be noiseless. It should be noiseless. You know what? It should be effortless. Nobody should know you are breathing. I mean, I'm breathing now, but you don't know whether I'm breathing or not. But that is how you should be. You shouldn't hear any noise. You don't, actually, in this age group, usually for the babies, yes, because their airway is still soft and being developed. So yes, we can hear some noise. But for usually for 5-year old, they should be noiseless breathing. So if your child is making noise when breathing, I worry about it. It means that there may be something, an obstruction or something on the airway. That is number one. So number two, sweat is I don't know about whether I think when you say the sweat is yellowish, I guess what you meant is the stain of the sweat itself. in the clothes. And it also depends on what kind of cream or what kind of things you are rubbing on the child's body, or how dirty the child is. If the child has been so dirty and maybe they've played rough play in the sun, which is fine, which is what we encourage children to play, but you just need to make sure they have a bath, before they go to bed, and make sure the room is cool, and make sure it's well ventilated. That's also, there's nothing wrong with the child sweating and being smelly. If your child is very active and busy and you know playing rough, and then they don't clean up properly before sleeping, they're going to be smelly, they're going to be wet. I mean, that is not um anything to worry about. But just make sure the child have a bath, and make sure that they are clean. You sometimes you need to supervise them. The 5 year old cannot bath by themselves, they are not going to do it properly, so you need to still supervise them. I know you are saying, oh, they are independent now, they are not going to do it properly. So you still need to supervise them, and so that they change their clothes, they have a proper bath, and then make sure your room is not too hot, and make sure it's well ventilated. So, but for the breathing part, you need to see a doctor. We need to know why the child is having noisy breathing. At 5 years old, you shouldn't be having noisy breathing. You should be noiseless. You should be effortless. So any difficulty with breathing, noisy breathing, there's something wrong, and we need to know what it is, and we need to deal with it. So I can think of what are the possible causes, but it's better you let the doctor see your child and take it up from there.
All right, thank you, doctor. We're moving on now. Please, what causes fairness in babies' folded parts of the body, right? Example, the neck, armpit, buttocks, and even the face.
So usually that is a fungal infection. It is not that kind of fairness. We call it discoloration or hypopigmentation. So it is, and usually we see that in children who have what we call intertrigo. So it's a form of fungal infection. So, but what gives away from what you wrote is it tends to happen in the folded parts of the body. So the neck, the armpit, the thighs, those folded areas of the body. So usually it's a form of fungal infection. So you need to see a doctor, and they need to get the child treated properly. And then more importantly, prevention. You need to, the folded areas of the skin tends not to be cleaned properly, because things just go over them. So you need to be deliberate in cleaning those areas. You didn't talk about the age of this child, but most of the time they're actually in babies anyway, and you must deliberately make sure you wash in between the neck of the babies, the armpit. You must be deliberate washing those areas and keeping it dry. Also, they also tend to be areas where there still be a lot of sweaty and dead tend to hide inside them. So you must always wash them properly and then dry them properly and keep them dry. So some of you, when your babies are feeding, your babies on their neck, all those things, all the dirty stuff has taken there, and you are not taking note of it. And because it's folded, you don't tend to know that there are things inside that are hidden away. So you need to make extra effort. But once the child already has the infection, you need to get that treated first. So then we can now move on from there. All right. We need to be rushing now.
Yeah, exactly. I don't know what to do. My son of 4 years don't like eating. He can stay the whole day without eating food. Please, what can I give to him?
There's nothing you're going to give him rather than the food. It's a food. So it's a fussy eater. So there's no drug. So let me just bust that bubble or disappoint that expectation. There's no drug that you're going to give him to make him eat. So it's still going to be food that he's going to eat. But you just have to be patient with him. Even if it is one or two food he likes, give him more of what he likes, and then gradually introduce new food. Gradually, and then you can allow the child to eat more often instead of eating big meals 3 times a day. You can let him eat, even if it's that little quantity, but you can do it several times in a day. Some children are like that. There's nothing you can do, but you just make sure at least they eat enough to keep themselves alive and not be malnourished. So that is the goal there. So don't fight, and it's not going to help you. So you sometimes just have to be supportive. So if the child likes to eat a particular food, rather than let the child go hungry for the whole day, let the child eat the same food every day. But you can now make sure you had other things that he doesn't like much of it, and at least just to balance it up a little bit, just a little bit of reward. So if you eat this particular one that you like, then we can give you this particular one. If you eat this particular one you don't like, then we can give you more of this one. sometimes we call it positive rewards, encouraging the child and all that. So if you do this, then you can have some more time on your tablets, or no, just have to encourage them. Some children actually have what we call eating disorder. If it is really that bad, then you need to see a pediatrician, because the child may actually have an eating disorder, and we need to take it up from there. But most of the time, they are just fussy and picky eaters.
Right. So, we're moving on. Please, is it compulsory to always burp the baby after feeding, even if baby is sleeping? Secondly, is it okay for mom and baby to lie down while breastfeeding, especially at night? Sometimes both mom and baby sleep off. Is there any side effects? Sometimes I notice my baby starts coughing and some drops of breast milk drops from his nose.
Okay, so first, it is not really necessarily compulsory to burp your baby, but you didn't always put the age of the baby. So for young babies, because they tend to reflux, so we encourage you to keep them upright for 15 to 30 minutes before putting them to sleep, so that at least the tendency of them to have reflux is less. Two, there's nothing wrong with you lying down to breastfeed, but you must know how to do it. Because if not, what you are doing, for example, your baby is aspirating. That's why your baby is coughing, and that is why breast milk is coming from the nose, because you are not being careful doing it. Because the milk is coming out from the nose, the milk is going into the airway, and that is dangerous. So if you are a new mom, you are not very comfortable, you don't know how to do it, please sit up and breastfeed your baby before putting the baby to down. So some mothers inadvertently kill their baby blocking their nose with the breast milk, because like you said, you slept off and you've forgotten that you're breastfeeding. So it's a very dangerous thing to do. So it takes time. As your baby gets older and you also get more experience in breastfeeding, you know how to do it and support your baby and then all that. So be very, very careful. If you are not very careful, you can lead to aspiration. And this your baby, I worry that you're already doing that. So please sit up. You can sit up on your bed and rest with support your back with a pillow, and then still breastfeed. You are still on your bed. You are not necessarily sitting down out of bed, but not like you are lying to breastfeed. But as your baby gets bigger and you are more experienced, you can do lying down breastfeeding. So that's my advice for that. And we also prefer babies sleep on their own beds and or in their own cots rather than on your bed. It can be next to your bed, but because the chances of some mothers are very deep sleeper, and you know yourself, you roll all over the place. We don't want you to choking our babies to death. This may sound funny, but these things happen. So please, it's better you carry the baby and put on the bed, or put the baby to one corner. Some of you have those, you don't have a cot for your baby. Then let the baby be on the corner of the bed, closer to the wall, and then you can be next and all that. Then you be very careful. If your husband is also on that same bed, you will have to be very careful. But if you can help it, just put the baby in the baby cot and let the baby stay separate. And then you can, go ahead, breastfeed and carry back. But if you have to put the baby by your side, please be very conscious of it and be very careful. All right. I think
All
that's
right, thank you,
I think
doctor.
I need
We
to rush.
have just 6 minutes. Do you want to rush through them and
Yes, let's
answer?
just rush through the rest
All
of
right,
the question,
all
and
right.
let's close. Okay, so that more questions don't drop. So I think we should just take all the ones that have dropped now, and not anything after. So 3 weeks old baby, block nose due to cold. Use nasal drop. If he has cold, what else to do? Keep breastfeeding your baby. Keep your baby warm. Keep breastfeeding exclusively. It will go. It may take up to like 2 weeks, but it's going to go. And avoid maybe coming in contact with people that have cold, because if you are treating and you baby keep getting exposed, it's not going to go. What causes a baby not to suck directly from the mother's breast? There are many reasons why a baby is not sucking. I'm not going to go into all that because it's going to take so much time. It could be as simple as the fact that you are not even you are not attaching baby properly to the breast, what we call poor latching onto the breast. The baby is sucking on the nipple, there's no milk flowing, babies be tired. It could be the baby has some medical conditions, so some baby has some heart problems, maybe has some neurological problems. They may not want to suck. Baby may be sick as well. So if your baby is not sucking from the breast and you've watched our breastfeeding videos, you are doing it properly, you think you are doing the right thing, and your baby is not sucking, please see a pediatrician, because there may be a medical issue. Okay, we've answered this question already. Rosalind, baby is 2 months, supposed to resume work by Monday. What do you give your child? Breast milk, of course. So going back to work does not mean you can still not exclusive breastfeed. I did it. So for me, I took my baby to crash in my workplace, so I can go. They can call me during break time to come and breastfeed my baby. So you can do that, or you can express. Even then, I also have to express. You can express. So we have a breastfeeding video for you on how to feed your baby when you resume work. But summary of it is you express your breast milk and you give it to the nannies and they will give it to the baby. And when you are back, you continue to breastfeed. It is possible. It is possible. Many people have done it and you can do it as well. It's a matter of I can do it and you will do it. If you also want to do it that way, you can also take your baby to the crèche and you just go and breastfeed your baby. They will just call you when your baby needs to breastfeed. You go and then you come back. Rosalind, okay, I think I've answered that. Young queen, 17-month cry, throw up when left to cry for long, say 2 minutes. This can be annoying, especially when I need to stand my ground. So I don't know what is the issue with you and your baby. So why do you also want the baby to cry for 2 minutes before why are you making baby to cry for so long? Is it about discipline now? Is it about like the child wants something, is having a tantrum? So it is normal for children to have tantrum between the age of 2. That's why they call them terrible twos. So you need to know uh how to go about doing the parenting. So I think for you, I would recommend you go through our rules of parenting on our Facebook group. We have a lot of tips. So for this age, they can't reason. Don't treat them like adults. They don't understand. They don't understand what you are trying to get them consequences. They don't understand. You are the one that is thinking they don't. So what you need to do is to remove the child from the situation and put the child somewhere else. Or distraction. Give the child something else. Then they forget the other things. So you have to know the right tips for the right. So I see a lot of mothers trying to reason with their 1-year-old or their 2-year-old. It's a waste of time. They don't understand. They are cognitively not yet developed to that level. So you need to understand how children think. So you know how to deal with them. All right. Hope is saying, how many times can you feed a 6-month-old on solid and breast milk? So a 6-month-old should be breastfeeding on demand, the same way you were breastfeeding before. And then when you start complementary feeding, it's just 2 times in a day, just twice in a day. So please, Hope, you need to do our complementary feeding guide in our group. It's very important. Before you do anything, go and do that complementary feeding guide. Watch all the videos. It will save you a lot of stress. When can I start holding my baby's hair into small bond? Okay, whenever you want to, whenever you think you're ready, just make sure you don't put too much pressure on the scalp of the baby. Good evening. My baby 8 months is rejecting food. She prefer eating what I eat out of. Okay, so this kind of person, you don't understand complementary feeding. That is the question. So please go and do complementary feeding guide, because if you do complementary guide, you will know that there's something called adult food. Food is food, and your 8-month-old can eat everything you eat. All you need to do is that the texture may be not as solid. It needs to be semi-solid, mash, porridge, puree like. So it shows you that you are the one that don't understand. Your baby don't need baby food. Your baby need food from your kitchen. So I would really, really want you to go and do that complementary feeding course, because you will get all the answers to your question, because it's a lot. This is one of the underlying confusion about complementary feeding that causes a lot of headaches for mothers. It's just simple misunderstanding. 8 months is standing, leg are cuffed. Is the baby ready to stand, or you're forcing the baby to stand? Because that is one thing. So if it is you forcing the baby to stand, please stop. Let the baby be ready. But if your baby is standing and there's an abnormality in the shape of the leg, please see a pediatrician or a physiotherapist. We just need to be sure there's nothing abnormal with the legs. So that's number one. Equal Grace, my baby is pre-time, 34-week, weight 2 kg. The weight is fine. He has viral infection. Can antibiotics be given to him? No. You already say he has a viral infection. Antibiotics is for bacterial infection. Antivirals, they don't need no medication. His breathing is noisy. The doctor prescribed antibiotics. So you should ask your doctor why your doctor is prescribing antibiotics for your child having viral infection. It may be that your doctor is not thinking it's a viral infection. So that is between you and your doctor to clarify. But if it's a viral infection, there's no need for antibiotics. What can you do if your 2 weeks has gas in his stomach? Nothing. The gas will come out. That's it. It will come out when baby belch or when the baby pass through. All the gas will come out. But avoid baby sucking hair unnecessarily. Okay, our time is up now. Baby of 8 weeks on EBF, blah blah blah. Yeah, it's not still for a week. Should I be worried? No, that is normal. So babies on EBF, they don't pass stools every day. But the stool, when eventually they pass it, it will still be soft. Baby is otherwise fine. Their tummy is not swollen. They are not vomiting. They are well babies. So there's no reason for you to worry. 8 month old doesn't like fruit, whole or mashed. I noticed her legs hasn't gained much weight. Her legs. I don't understand about leg gaining weight differently from the rest of the body. Okay, what you mean the baby is not able to stand very firmly? So there are many ways to give your baby fruits without them knowing. You can put it in their cereals, for example. You can make it like if your baby is taking cereal, you can put your banana into it and mash it into it. You can blend your apple. You can make. So there are many ways to give fruit without necessarily giving it like directly to the baby. There are many ways, so you may need to watch all those our complementary feeding videos. The issue about the weight, the legs, I'm not sure I understand, but please, if you have concern about your baby's legs, please see a doctor, see a pediatrician. But it's not about weight. The babies don't need to gain weight on their legs. So maybe if you are talking about the child's ability to bear weight on the legs, maybe that's what you meant. But the question I want to know is that can your baby sit by herself without falling backwards or not? If baby can do that, then there's no need to worry. But if your baby has other issues, then please see a pediatrician. Weight of 3.2, 3 months is 5.8. The weight is fine, no worry. Just keep breastfeeding exclusively. Breastfeeding mother got pregnant with a 7 month old baby. Can she continue breastfeeding? Yes, she can continue breastfeeding. Please do family planning. Do family planning. There's no reason why you should be getting pregnant when you still have a 7 month old. It's because you don't do family planning. And as long as you're having unprotected intercourse, you can get pregnant, even whether you're breastfeeding or not. So please, breastfeeding is not 100% protected. And it is not just about the baby, it's about you. You are putting your own body at so much stress. You have not finished recovering from one, you are going through another. There are lots of issues. I don't know why mothers are always so scared of family planning. Please do family planning. Let's not stop asking this kind of questions anymore. Okay, while bathing a baby, the bath water that contains excessive immediately enters baby's mouth. What can be done? Nothing can be done. So try and be careful. That is why we say don't splash water on baby's face. Just put the water in a face towel or foam and just clean their face. That's all you need to do. Just wipe the face. You don't need to be pouring water, pouring soap. And no, just wipe the face. That's all. They don't need any. And I think our dermatologist said you shouldn't even be putting antiseptic in the water. Just use clean water. You can boil the water as well. Okay. 6 month old has eat rash. Cannot help him eat rash powder. Yes, you can. 4 months old after that for 1 month. Oh, is it the one I've answered before? Okay. Just take this baby to our hospital. If your baby has catarrh and cough for 1 month, that is too long. And please don't go to a center for that kind of a case. You have to go to a general hospital or a hospital with a pediatrician. Okay. Baby with scanty hair, almost bald, grew a bit, lost most of his hair. Don't worry, some people are born without hair. There's nothing wrong. The hair will grow eventually. But if there's some rashes on the head, then that's what you need to do. But you already told me your baby is LD, there's no issue. So please leave the baby's hair alone. Breast milk, I'm actually putting out the breast because I'm on EBF, but you're not lactate, so just relax. You can lactate well if you are you just need to relax your mind. You can lactate well. Breastfeeding is demand and supply. The more your baby suck, the more you will produce. If you are giving formula, you are not going to be putting your baby to the breast as much, and that means you are not going to produce as much. So just clear your mind, put your baby to the breast, just keep putting your baby to the breast, drink well, eat well, rest, relax. Let other people help you with other work. The milk will flow. Just trust me, it will flow. You can watch our breastfeeding videos on how to increase your breastfeeding supply. There are a lot of information. Can I buy a walker for a 8 month old baby? No, 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 no. No to walker. No, no to walker. Walker should be banned. Please do not use walker. It's the most dangerous piece of equipment not necessary for any baby to use. I've seen babies suffer lots of injuries using walkers. Please, pediatricians don't recommend walkers. We frown at it. It has been banned in places like Canada. We don't want babies using walker. The physiotherapist said it even delay your child walking. So please don't use walkers at all. All right. I guess I'm almost done now. I'll like my question on expressing breast milk, blah blah blah, blah blah blah. Okay. So if you're expressing your breast milk and you think you're able to crash, your crash should have a fridge. A decent crash should have a fridge. Why should they not have a fridge for you to keep your? So if you express in the morning, from the time you go from home to your work, 1 hour is still okay. When you get to work, let them just put it in the fridge. You don't need to put it. You don't need to get any ice block, any special thing. Just express it. Put it in your own fridge at home. Then when you are going to work, take it with you, whether in a box or whatever, but that 1 hour is not going to cause any harm. The breast milk can stay for 6 hours on at room temperature and nothing will happen. But I think when you get to the crèche, most decent crèche will have fridge where they can keep the breast milk before the baby use it. I visit hospital, high sugar and heck to the pub she's taking. So what is the question? You've not, I don't know what is it. Whatever your doctor advice, you follow your doctor's advice. But there is more information on complementary feeding. You can go to our Facebook group for that. But 3-year-old weighs 10 kilos. He doesn't like to eat. The weight is not okay. A 3-year-old should be weighing close to 14 kilos. So this baby is underweight, and that's the weight of a 1-year-old that your baby is having. So you need to see a dietitian or a pediatrician because there may be other issues. It may not just be about food. We need to be sure there's no health issues. So please see us. We don't have fridge or freezer in my workplace. Oh, okay. My baby is 3 months. How can I express that my fridge is not freezing? Will it still be okay? How can you not have fridge and freezer in your workplace? Okay, tell your boss to buy one. Seriously, I'm not joking. Tell them to buy one. All employers must support breastfeeding mothers. They have to support you. And one of the ways they can support you is by making sure that those kind of things are available. You can express your breast milk, but I don't know how long it takes before you get home, but it can stay for up to 6 hours. But I think there should be a small fridge in your office, please. They should buy one. Even if it's just one for the whole of that complex, they should get one. It's very important. It's very important for a mother breastfeeding. Okay. I thought I finished. No way. I'm gone. Oh no. I guess I'm going to just stop now because time has gone. Okay. Where am I? Oh my goodness. 1 year, 3 weeks old baby has 5 teeth already. The teeth looks yellowish and decaying. You have to see the dentist. You have to see the dentist for that. My baby of 8 months has not grown teeth. I'm worried. There's no need to worry. Some babies don't grow their teeth until they are 1 year old, so no need to worry. Just so, can I cook a considerable quantity of food for my son of 6 months, blend and store in the fridge and remove in bits and give? No, it's better you make it fresh every day. And your baby of 6 months don't need this plenty of food and all that. No, do it every day. The fresher, the better. Yeah. My 5 week girls always vomit through her nose even when sleeping. No, that's not right. That may be your child is having reflux. So try and keep your baby upright. Try and keep your baby upright for 15 to 30 minutes after breastfeeding. Just 1 minute. Okay, sorry. Okay. Okay, I think I've answered that. Good evening. Good evening. Oh, where are all these questions coming from? Can 6-month-old take oranges, watermelon, banana? Yes, they can. Oranges have to be diluted at 6-month-old, and you have to watch for the quantity. For your watermelon, you need to remove seeds. You have to be conscious of that. Please, can I give my baby of 6 months frozen blind? Okay, so I'm seeing a lot of questions on complementary feeding. Please, if your baby is 6 months and above, you have questions about food, please, we have what we call complementary feeding videos on what to give, how to give, quantity to give, all these questions. Please, please watch those videos. You go to our Facebook group, ask or just look for guides in the menu section. Go to the guide section. There's guide 1 is on breastfeeding, 0 to 6 months. The guide 2 is on complementary feeding. Please watch all those videos. They are not long. They're about 5 to 10 minutes max. And you watch them, you will understand everything about complementary feeding. We also have a write-up article as well there. Please, I strongly recommend you do that first because it will really answer all these questions, because like if my ATP life today has been turned to a complementary feeding question. So yeah, blended fruit. So when you are starting at 6 months, you are not going to start them with very solid. You're going to start with something smoother, softer, semi-solid, and as they go older, then you go to things that are rougher. The texture is not as liquid. Then by the time they're about 1 year, then they can go on full solid. So you really need to understand all that, because I'm seeing all sorts of questions about frozen blended fruits and possible. I mean, that's not what we really want for a 6-month-old to start with. So you really need to understand when you are starting, you start small, you start gentle, you start slow, and you gradually go higher. From texture, from quantity, it has to go up like that. It's not, you have to be very conscious. So that's the most important. It's not that the child cannot eat any food, but the textures have to be different. You have to be conscious of that. Dry type of pap. I mean, for my son doesn't like it. I mean, you know, if cellular and phosphate can be used as something for what is phosphate? I don't know. Your baby can eat anything you want the baby to eat. Always put the age of your child in any question, though. What is? Oh, thank you. Okay, this is just a commendation. Chidiogo, I think we've answered your question. Okay, this is a repeat. We've answered that. Sarah, constant cough, cut over 6 months, rubbing of those sound like allergy. You need to see a pediatrician. There are drugs for allergy that they can use. Different color on the neck, sound like a fungal infection. You need to see a pediatrician. Sorry, I'm going to be doing one answer now because of time. 1 year is small. What I can use toothbrush. Once the baby has teeth, you can use toothbrush and toothpaste from the very first tooth, even at 5 months or 6 months. You can give a big cheese. You can give a bit cheese. 6-week-old on non-formula, can I switch over to another one like lactogen? So formula should be prescribed by a pediatrician. There are reasons why we give formula. What we recommend for you is to exclusively breastfeed your baby. That is the best for your baby. I'm not going to promote any formula. I'm not going to recommend any formula online because I have to know why I need to do that for your baby. Okay. Baby is not as far. Baby of 3 months who is weighing 5.4 is okay. That's weight is fine. There's no need for you to worry. Just let that baby continue exclusive breastfeeding. Baby pull 5 times a day for 3. That is fine. It look like that's normal. So baby can pull up to 12 times a day as long as it's normal to texture. It's not watery. It's not reason to worry about. I think that's fine. Can I get the speech therapy in General Hospital Lagos? I don't know. You can try. You can ask them. But most of the teaching hospitals are where you get the speech therapists. The 10 weeks, 37.3 is not fever. That is normal temperature. I don't know what you're saying, but your baby doesn't even have a fever. That is not fever. 37.3 is a normal temperature. Change on voice, 10 months old, I don't know. Just leave the baby alone. Just watch. Just watch the baby. There's nothing wrong. Eunice from YouTube says, Angela, did you see my notes? His birth weight was 3.8. Current weight is 8.5. Okay, good. Your baby is doing well. I don't know. Yeah. Okay. I think. Oh, that one's just a commendation. Oh, thank you, Inesa. Thank you for joining us from YouTube. I love it when I see people from YouTube. It's nice that we have somebody from YouTube. what should be the head size of a 4-month-old baby? So what was your baby's head size at birth? Then we can work out what it should be as 4 months old. If you are worried, then you need to see a pediatrician. It varies the range. It's not like a particular figure. We need to know what it was before and see whether a baby is gaining appropriate head size. Any side effect for your baby if it takes little breast milk from birth to 8 months? I don't understand. There's no side effect with taking breast milk. I'm not sure I understand that question. Abenda so for the want me, they give you Rectras, Because I gave my baby only 5 mil, and I give her the remaining 10 mil or throw it away. You throw it away, yeah. Because the next time you are going to do one is going to be in 6 months' time. I don't know what is the second part of your question, Facebook user, because I don't see your name. You have to ask that second part of your question again. I work in a bank. I won't be allowed to go to breastfeed at intervals. Care crash won't be able to handle express. No, there's no. If you go to a decent crash, they will handle express breast milk. I said this last week, and I'm going to repeat it. If a crash is not decent enough to handle your breast milk, they are not decent enough to keep your baby. If a crèche is not decent enough to make sure your baby take breast milk, they are not decent enough for you to keep your baby there. So please don't even use that as an excuse, because formula is even more dangerous for them to make, because they are going to mix it, they are going to use bottle. You are not even there to know whether they are being very sterilized, washing their hands and all that. Whereas the breast milk, they just take it from where you brought it from and feed your baby directly. So make sure you use a decent crèche. Any crèche that cannot do for breastfeeding, they are not decent enough to keep your baby. So that is what I will say. I'm not going to recommend formula for you. There is no way I'm going to do that. So we are pro breastfeeding and we don't recommend formula. So breastfeed your baby. You can see your doctor and they can. Okay, all right. Thank you, Angela. We're almost running up now. So please, but you can see your pediatrician for the formula prescription. But what you just gave is not, they are not excuses for not breastfeeding at all. Seriously, they are not. They are not the reason why a pediatrician will even prescribe formula. You can do it. I trust you. Okay. Yeah, you can give ORS, whether orange flavor or plain. Anyone is fine. Whatever your baby likes. We use the orange flavor because some people don't like the plain one. But when they see what look like orange, they want to take that one. So it's fine. It's fond of putting her finger in her mouth even when she's full. She like pretending her tongue. It's just, these are habits that babies do and they will outgrow it. Okay, I think I've finished all the questions that came in before 7. I can stop now. Okay. Final question. 9 months old with the eyes is red, they like itching it. Baby may have what we call allergic conjunctivitis, and you need to see a pediatrician and they will be able to treat it for you. Thank you so much. I think I've answered everybody's question. I hope so. Yes, I think I did. Oh, lovely. And I think I did also on Instagram. Good. All right. So thank you so much for joining us today. I think I did well today. I didn't go beyond so much. Okay. All right. Thank you so much. Angela, do you want to say your final goodbye?
Yes, thank you, everyone, and good evening once again. Thank you for joining us. Don't forget, you can always watch this. There will be a replay link on our Facebook group after now. Have a
Okay.
good evening.
Yeah, thank you so much. So if you have not answered your question, then you can post your question on our Facebook group, and somebody will help you to answer that question. I'm just reading somebody who said I didn't answer the second part of our question. She doesn't breathe through the nose, so you don't need. So the whether you go through surgery or not is not for me to answer. That is for you and the doctor who recommended surgery in the first instance to answer that question. So you should go back to that doctor, and that doctor should decide whether she want. From what you told me, I would say your child doesn't need surgery, but I'm not the doctor who recommends surgery, so I don't know what the doctor saw, and I don't know what your baby is like now. So I'm not going to go by what you tell me, but that doctor knows your baby before. The doctor will see your baby again and can decide whether your baby need a surgery or not. So I hope I've answered your second question. Yes, some people say my questions are not answered. I apologize for that. We have only 1 hour, and some of you, your question came in after 6. No, sorry, after 7. I'm 1 hour behind. Your question came in after 7. So if your question came in after 7, you're already late. So what that means is that but not to worry, you can post your question on our Facebook group and we will answer them. So I will see you again next week, God willing. And so bye from me. Bye from Angela. Bye.
Bye. Bye bye.
Bye.